So now that you're here, you're doing this presentation, maybe you can give us the top 3 or 4, points that you want people to walk away with so they can improve the way they practice medicine.
Sure. So the title was one that I was assigned more than one that I created. I don't think I create titles that are quite that interesting. But I must admit, the more I've looked at that title, the more I've realized that it's actually quite interesting. If you look at rates of amputation over the last several years, especially amongst those who have diabetes, the general belief is that those rates have gone down, that there's fewer diabetics who are having amputation over time. But part of what's misleading about that is the definition of diabetes has changed over the years. And people 10 or 15 years ago who probably wouldn't have been called diabetic are now called diabetic, and it's maybe changed what that rate really looks like. And if you actually look even more closely at some of the numbers, the actual number of amputations in the country, while it's also gone down, has not gone down as dramatically as the rate of amputation. So we may have gotten better at diagnosing diabetes, and by getting better at diagnosing it early, it artificially looks as if we've gotten much, much better at preventing amputation. And that's probably the most important point of the talk. And while the title's interesting, is that it may be just the call before the storm, because many people have always assumed that amputation was a rather late complication of diabetes. And if we've gotten better at diagnosing diabetes early than what we did 10 years ago, it may well be that in the next few years we'll see an uptick in the number of amputations, because again, it's a late complication and not so much an early complication.
So what kind of numbers are we looking at when it comes to the prevalence and the rates of amputations?
Yeah, so the incidence of amputation about 10 years ago was about 10 per thousand, and it's down to about 3.5 per thousand now. But the number of people being amputated really hasn't changed quite that dramatically. So it's considered a fairly common chronic complication of diabetes. The precursor to amputation are foot ulcers. And foot ulcers probably occur about 15% of those people who have diabetes, probably about 15 to 20% will have a foot ulcer at some point in their life or their time of having their diabetes. Those who have a foot ulcer, they're much, much more predisposed to almost anyone else to go on to have an amputation, especially those people who have foot ulcers who also have arterial disease, who have problems with the flow of their blood down into their feet.